Work is underway to insure hundreds of thousands of New Jersey's kids. I'm Jill Horner. This is Comcast Local Edition. With me this hour is New Jersey Assemblyman Lou Greenwald. Thanks so much for being with us.
Thanks for joining me.
The FamilyCare program helps to provide insurance for families in New Jersey, particularly for kids. But at this point, we have 360,000 uninsured kids in New Jersey. How does this program help to try and identify these kids and get them insured?
It's a scary number, really. The economy is having an impact on everyone, and what you see really is it comes all the way down to children, not just on grown-ups and adults, but when you have a family that's not working right now, that when they don't have insurance, it falls down to the kids as well. What we have seen over the course of the last couple of years is in 2006 and 2007, we had all-time highs of children who were uninsured, 294,000 kids. Last year, latest total, 360,000 children. The sad part is 2/3 of them are eligible, and we're seeing a growing number of uninsured. What we saw last year was 2.4 million New Jerseyans out of 8.5 million didn't have insurance. 1.8 million of them didn't have insurance for over 6 months. That was up from 1.4 million. And again, out of that 1.8, 360,000 are children.
So how will the expansion of FamilyCare and trying to reach out to these families really make a difference? How are you working to identify these kids?
Well, what's important is in these tough economy that we deal with right now, this isn't about a program that needs more money. The money's there and set aside, and it really is, as we've talked about before, pay me now or pay me later. If we don't insure these kids, we will be paying for them in emergency rooms known as charity care, where people who don't have insurance have nowhere else to go. They show up in the emergency room. So we're working directly with hospitals to make sure that children and families are enrolled. We're working with school systems to make sure that they're enrolled. But really through some legislation that I worked on last year, there's a new program for all of us who just filed our taxes. There's a box that you will check off whether or not you have insurance and whether or not your children are insured. When we check off that box, we now have state departments that are communicating with each other. And if it shows up that they've checked off a box where they're not insured, they'll check the income eligibility, and then through the FamilyCare Express application, they will send them out an immediate application, one-page application, quick, easy, simple to fill out, and you can register your child right there.
So really streamlining that process, making it easy for parents and guardians to get their kids enrolled. But what about for those families that don't necessarily file income taxes? Maybe for undocumented workers, their kids still have health care needs.
If you pick up the papers, if you watch the news, you see a growing number of undocumented in this state and in this country. It is an issue that obviously governments are dealing with across the country. 40% of New Jersey's population growth will be in immigrant population. If they're not filing taxes, that system won't work. But when their children do get sick, they do show up in the emergency rooms. We have mobile health vans in many of the communities now that travel around. All of them are working together. The federally qualified health centers are registering families and children because they are eligible. And many of these immigrants, they move to this country or to this state to take advantage of the public education system that we offer. And again, that's why the schools have been great partners in this as well.
Would their kids qualify for this program?
Absolutely. And it's through a combination with the federal S-CHIP program, which is what it piggybacks onto that program, and because it is an eligibility issue at the federal level and they qualify, it rolls to the states. And again, I know many people, that can be a controversial issue with some people, but the reality is that if we just went through an experience with a supposed swine flu epidemic. You want people to be healthy. You want our neighbors, our friends, the people that are going to school with our children. You want people to have the necessary medical care that they need, because it can become a serious problem quickly.
Let's talk about this from a dollars and cents perspective. Obviously, you're having this outreach to try and get kids enrolled, but for those who aren't enrolled in the FamilyCare program, how much of an expense is it in terms of charity care when a child, for example, shows up in an emergency room because of something like an ear infection?
We are spending right now at the state level somewhere between $600 and $700 million a year to help offset the care for people that show up in an emergency room without insurance. In addition to that, we spend tens of millions of dollars more, $40 million this year for federally qualified health centers that are healthcare clinics around the state. That is a fraction of the cost. Our hospitals, which is our second largest employer, pick up a significant percentage as well.
All right, well, thanks so much. And a one-page application can make the difference in getting your kid insured.
Quick and easy.
All right, thanks so much. We've been talking with Assemblyman Lou Greenwald. I'm Jill Horner for Comcast Local Edition.